leukemia is not the only disease that will be cured by a transplant. I'm sure some of you have seen the video that was projected here. Somebody with an immune deficiency problem. I'm not talking about HIV/AIDS. I'm talking about certain immune deficiencies that children are born with. There are diseases where the bone marrow does not produce cells adequately. It's called aplastic anemia. There are conditions like thalassemia where your hemoglobin is not normal. So there are many, many non-cancer related conditions also where you will have to do a transplantation for curative treatment. So as I said, the problem is increasing. The number of patients who need a transplant is increasing. On the other hand, the number of donors is progressively going down because of complex diversity in the genes and single children families. So where do you go and get a donor? It's really very difficult, and that's where people like Dhatri really come in. Now, when 10 years ago somebody proposed to have a registry like this in India, I certainly did not believe that it would happen at all. Because this is something that people in the West have realized many, many, many years ago, and the donor registries in the West were set up many years ago, while in India, although we have a big need, we did not do anything about it. So when somebody spoke to us about it, we really scoffed at them and said, look, this doesn't happen in this country, it's not possible. And then slowly, 3-4 years ago, when Janaki walked into my room one afternoon quietly and sat and said, look, this is who I am, and this is what we propose to do, even then I never thought that something like this would happen. Okay? But today, what we are seeing is going to be, or rather what we will see is going to be a real magical moment. I have not witnessed a moment like this. I've been a cancer physician for almost 15 years. Dr. Prasad, who's sitting here, has been in this field for 20 years. I don't think either of us have seen something like this happening. Okay? So it is important that we contribute constructively to what Dhatri is doing today. And the best thing that any one of us can do is to pledge our marrow to them.